Hello everyone, and
Hi,
thank you very
everybody.
much for tuning in to our Treating Long COVID with Shiatsu and TCM webinar series. And I'm delighted to be able to introduce Malika Meddings to you. So do you want to say hi, Malika?
Hi, everybody. Lovely to be here.
And I'm going to just see, we've got people tuning in already from all over the world. Great to see some familiar names there. And I'm going to just run the slides, the first two slides. So we've got a 5-series webinar. We're going to be building an online course as well for this very topical subject. And I just want to take a moment just to introduce Malika. She is uniquely qualified to be helping me construct this course. She was my first person I called up when I had the idea. And the reason for that is because she's not only a Chinese herbalist, she's got a lot of experience of treating long COVID as part of the Jade Screen Project. I'm sure we'll talk a little bit more about that later on in the series. But she's also got a lot of Shiatsu experience as a client and also as an advanced Shiatsu student. But also she's actually had COVID at least once, Malika, right?
Yeah.
And she's been treated with Shiatsu and with Chinese herbs, both separately and at the same time. So maybe you'd just like to say something about your own experience then. You've had so much experience from every side of COVID, haven't you?
Inside and out, absolutely. I think it was, the end of 2019 when I just got sick with something and nobody knew what it was. In and out of the GPs. And then I called my wonderful Shiatsu practitioner and said, help, and had some Shiatsu sessions post the infection, but I was still having these recurrent fevers. And that definitely helped. And then I stopped having Shiatsu for a little bit, and I called my Chinese herbalist and said, help, I'm still stuck in something. And I had a course of herbs. And then when I realized the herbs had helped me to a certain level, I just felt that overriding feeling was of something was just stuck in my body and it needed moving in order to get out. And that's when I started a course of about 5 months where I was seeing you every 3 weeks, I think, and then taking phenomenally strong herbal formulae for that time. And then the thing of having the herbs and the Shiatsu together, the herbs almost guided the thing out of my body, and then the Shiatsu helped to move it when it got stuck. And that's when I just skipped and spiraled out of what I think actually was my first experience of COVID. And then finally, when that took about 5 months, it was pretty scary. And that's when the pandemic really hit in about March 2020, and the lockdowns were coming. And that's when we started the Jade Screen Project. And so that was an amazing coming together of some herbalists, and we can talk more about that later on. But the experience of treating active COVID and treating people in recovery, and then what turned into long COVID for so many people, and coming together with other herbalists, because it's a freaky time, because none of us really knew what we were doing. It was this new virus presenting some pretty weird symptoms, but essentially post-viral syndrome, and working together on treatment guidelines, treatment principles. And when I got stuck, having some of the best herbal minds to call up and say, can you help me with this case, because I don't know what's going on. And so, we're about a year and a half later. And then in August, I got COVID again. And this time, as soon as I felt sick, it's just like, right, I've learnt some Shiatsu. I'm going to get on my stretches and my points. And I put myself the week beforehand actually on a proper medical dose of herbs. And I think that really helped. And so now I'm about 8 weeks post-COVID. I had it pretty seriously for about 3 weeks. And it's the herbs, and then as soon as it was safe to have Shiatsu after the infection, when I knew the infection had cleared, to start having Shiatsu again, just to make sure. And I don't think I've felt better in my life. I think it's cleared. I've had things going on for a long time. It's definitely cleared the virus, and I don't have post-viral fatigue. I feel very well. So I'm the poster girl for having Shiatsu and herbs. With COVID, and I'll sing from the rooftops.
It's absolutely great to have your expertise and all your experience. And of course, we're focusing mainly on Shiatsu practitioners, but we're going to talk about how Shiatsu practitioners can work with a herbalist if they need to, you know,
Yeah.
like you say, and if they want to work together. So
Yeah.
thank you ever so much for that. And what we do is we better get on. We've got lots and lots of material for you. Malika and I have been working away for a few weeks here, getting all this course structured for you. And this is the overview. This week is going to be really an introduction. We're going to look at diagnosis and treatment with Shiatsu and Chinese medicine so that you can really understand what happens energetically with the onset of COVID and with long COVID. And then we thought we'd divide it up into the 3 burners, and we're going to be looking at treatment protocols, symptom pictures, and techniques that you can do, and you can show your clients that you can, so they can help themselves. And then we thought we'd finish up with some case studies, treatment protocols again, and just generally like wrap the whole thing up on the 5th week. So hope you really enjoy that. So the program for today, we've got a lot in store for you in the next hour. We're going to find out a little bit about your own experience, first of all. Then we're going to look at the occurrence. We're going to look at some research that literally came out about a week ago on long COVID occurrence. We're going to quickly look at Western medicine understanding, just so that you've got an idea of how Western medicine looks at it. Look at some risk factors, especially from the Chinese medicine point of view. And then we're going to check in with you, see what level your TCM is, whether you need any help with that. We're going to find, and we're going to outline what's useful to know. I think also, Malika, it's useful to have a certain knowledge of TCM if you're going to work with the herbalist, because then you share that language, don't you?
Exactly. Yeah.
And then we're going to look at how COVID progresses in TCM terms, so you can understand the progression, and then understanding the symptoms, and then the role of Shiatsu treatment on COVID. And really, I think our overall kind of takeaway that we'd like is really to give you confidence of applying Shiatsu where it's most effective in the whole thing. I think that's what we'd like to do, isn't it, Malika?
Yeah. And I think knowing that how life-changing even 5 minutes of Shiatsu can be, I think would really spur people on to know how important their work is, especially at this time.
Yeah, fantastic. Okay, so let's go. Let's run some polls. Let's find out how many of you actually had COVID to start with. That's probably a good place to start. Let's just have a look. So could you just answer this poll, and we'll see how many of you actually have had COVID. I guess there's going to be a few not sures because people may not know whether it was actually diagnosed or they had it very early on in the pandemic, a bit like you did with the first one.
Yeah.
Okay, look, we've really got quite a high proportion there. We've got a quarter of the people who are voting have actually had it, and 20% are not sure, so they may have had it. So we're looking at getting on for half. I mean, that's really quite a high level, isn't it, of experience of the actual disease. Okay, so let's just follow up with the second poll. Have you ever treated anyone for COVID-related issues, either long COVID or vaccination, etc.? I mean, obviously, Shiatsu practitioners very rarely shouldn't really be treating at the highly infectious stage, but have you treated anyone as a practitioner? Let's just find out. Okay, I'm just going to share this poll. Have you ever treated anyone? Share now. Let's see. Yeah, here we go. Have you ever treated anyone for COVID-related issues, long COVID, vaccinations, etc.? It's going to be very interesting too, isn't it? Let's just have a look. But I think this is definitely going to be one of the things that's going to be a growing thing, isn't it? I mean, I think within a year, I'd be very surprised if there's any Shiatsu practitioners left on the planet who haven't had at least one client coming in, because it's just so prevalent, you know? Yeah. But even now, we've got 40% of the group voting to say they have, you know? Yeah. So this is an interesting poll to finish up this little group of polls. Malika suggested this, and I think this is a really good one, which is how confident do you feel in treating long COVID as a Shiatsu practitioner? And hopefully we'll be able to increase that over the next 5 weeks. That's the aim of this series of webinars. So how confident are you in treating long COVID with Shiatsu? Let's have a look. Okay, well, this is fascinating, and it just shows you how important this course is, Malika, and I'm so glad you're here to help me present this course, because look, we've got only about a third of people feel confident or very confident. About almost exactly 2/3 of Shiatsu practitioners on this webinar feel neutral or not confident. So there's a massive need here to, you know, really gear ourselves up and do the best we can for our clients because this is definitely not going to go away, is it? Long COVID is definitely something we're going to get more and more of in the Shiatsu clinic.
Yeah.
Okay, so here we are. Look, you may have seen this in the UK press. It came out, I think it was last week in The Guardian, I saw it, which is the latest research. University of Oxford National Institute for Health Research and the Oxford Health Biomedical Research Centre got together, and they found that 37% of people who had COVID had at least one symptom 6 months after infection, which is an awfully long time. And this is the next thing. I think it's one of the most interesting things, especially from the point of view of Shiatsu practitioners, is if you look at this is a breakdown of the most common symptoms. And you can see that anxiety and depression, which Shiatsu is perfectly placed to treat, is actually the most prevalent symptom that remains after 6 weeks. And also abnormal breathing, abdominal symptoms, chest, throat pain, fatigue, headaches, cognitive problems, muscle pain, and other pain. All of those are susceptible to Shiatsu treatment. Wouldn't you agree, Malika?
Absolutely. And I think someone was saying about when they were treating people with anxiety and depression, that their route in was to clear damp. And so while herbs are wonderful, there's so many ways of clearing damp with herbs. Shiatsu is also so well placed to clear damp because of the stretches, because of helping with the lung qi, because of helping boost the spleen qi. And also the thing of having, for the heart protector being in shock, I think, with anxiety, having been so isolated, to have that connection with your therapist, I think is key.
My own experience with the whole shock thing, it really is almost like post-traumatic shock, because not only have you got the illness, but you also got the whole vibe around, the whole vibe of fear around it. So the very fact that you've had that, you've been, even if you only have it mildly, the very fact that you've been through that process can put people into classic shock, like freeze. I mean, I've treated clients who have literally been in freeze, and just one treatment has broken them out of that freeze state, because literally their whole body, the heart protector channel, the mid-thoracic has been completely locked up, and it really can be quite transformative like that for that very prevalent symptom. So, okay, let's look back at the slides. So there we go. Shiatsu, I believe, really is really well set up to help. So let's just look at Western medicine understanding. And I know you know quite a bit about this, obviously, Malika, from the herbal point of view. So do you want to just describe, just go through this list and maybe give us a bit more of a description of what happens?
So when Western medicine was looking into, what is long COVID, they found that it's the non-classical monocytes, which are basically part of the immune system. They're a really small part of the inflammation that comes as a natural immune response to something, but it's these non-classical ones which can make up to about 11% of the inflammatory response. They kind of go into overdrive, and they're a wonderful part of the immune system, but if they stick around for too long, they can cause basically systemic inflammation. And then this is their job list of what they do. They bind to blood vessel walls, and they've got these spike 1 proteins that basically stud the vessel walls, causing localized bleeding and some inflammation, and also to the endothelial cells. So that's why we've been seeing people with blood clots in the lung tissue, and all these digestive issues that people are having with long COVID, is that it could be blood stagnation in their in their gut and then in their lung. They can also cross the blood-brain barrier, so then causing inflammation in the interstitial cell, the fluids around the cells, then causing vascular inflammation. And it's this persistence that they have, and this, they just stick around for such a long time. And then key to the whole thing is they're mobilized by exercise. So people, they start getting their energy back. It's like, okay, I need to go for a walk. I need to get back to my cardio exercise. Some people, their long COVID has started the first time they went back to the gym. And this is why, so it's in that key 4 or 5 weeks after the infection is cleared, people are slowly getting their energy back, they've actually still probably got systemic inflammation, which is why I think Shiatsu is so necessary, because it helps to move the chi, helps to release the fascia, helps to restore good fluid physiology in a time where people really shouldn't be doing, because exercise does all of that, but it's dangerous to exercise too hard in that time. So that's where Shiatsu is basically the white knight of this time, in that it will come in and help people so they get things moving, but in a non-inflammatory way.
Right, and that's the key, isn't it? Using Shiatsu to get energy moving without without the person themselves having to expend their own energy, because that's when you get the chronic fatigue. Okay.
And also there's one other really important point, if I can make that here. It's about blood stagnation. And so it's so important to keep moving so that the blood doesn't pool and get too stuck. And so that's, we know, when you were saying about people treating during the infectious stage, a Zoom call to show people stretches they can do, points they can press. I think, you know, I'm so lucky that I've had my wonderful training at the Shiatsu College, because I used it every single day, several times a day. But if I hadn't known any Shiatsu, I could have called my Shiatsu therapist and said, I need help. Or if the Shiatsu therapist knew their client had COVID, they could say, I need to see you, because I think it's so important that people do gently keep moving so that the blood stagnation doesn't settle in.
Right. Okay. So just gentle exercises, and then very specific. You used some very specific exercises, didn't you? Getting the heat out the lung channel and things like that.
Yeah, that was a scary 24 hours. I mean, I had a very high fever in my lungs, but not in my body. So the heat was building up, but not getting out. So I wrote myself a formula and I sent it to the dispensary. They got it to me within 24 hours. But in that time, I could feel the heat building so much in my lungs, it was drying my throat out. Like, no, this is not good. So I was holding lung 1 and then stretching out. And it would take about 5 minutes with proper, you know, using mind to get, I was just like visualizing like a smoking gun, and the smoke was coming out my hand. I was like, come on, lungs, you can do this. And 5 minutes. And it would take then about 20 minutes for my fever to, the fever in the lung to completely come out. And then my fever would come down. That would last for a little while. But I'd say pretty much every hour I was doing it to keep the heat out of my lungs, and it worked. And then the next day I got my herbs, and then I could rest a bit more. But I think that's emergency medicine, and I want everyone to know that.
You want everyone to know that, Well, there we are. This is a good way to spread it, isn't it? With the okay. So actually, Dominic's got one question here. So how is this different from other post-viral syndromes? There are similarities, aren't there?
Yeah. So I think with the course of things with other viruses, they follow a bit more of a normal course. And with COVID, it just seems to be a bit like a ping pong ball. You never quite know where it's going to hit or where it's going to land. And it can be quite overwhelming. So the similarities is that people generally spiral out of it, like they do with post-viral syndrome. But the fact that the coronavirus has this spike protein that attaches to the endothelial cells means that any underlying condition then can get exacerbated. And so then one person's long COVID looks so different to another one's. And because it crosses the blood-brain barrier, then there's so many nerve issues, and they can go anywhere. So one person's long COVID might be that they lose their sense of balance. Another one might be digestive issues. Another one might be chronic pain in their lungs, even though there's nothing on a lung scan. It's just the fact that it's all just seems so left field and quite overwhelming.
Right. There we are. So there are similarities, but also differences from normal post-viral syndrome. Okay, risk factors. Now, this has been there's been a lot about this, and I think, in a way, it's kind of just shows you how much the modern lifestyle has made us susceptible, I mean, to COVID coming along, really, because not only is it pre-existing conditions, exactly like you said, pre-existing conditions can kind of channel the pathology in different ways. Also, immune compromised people are more vulnerable, obviously, to it. What about your experience of poor or no early treatment, Malika? How do you think that affects it?
So, for example, the fact that I had my first infection, I didn't have any treatment at all for those first 5 weeks. It meant that everything got more entrenched in my system, and
Yeah.
so I think because we've treated quite a few people at the Jade Screen Project with active COVID, and we
Yeah.
just have noticed that the people who get treatment within those first 3 days is so important.
Right.
And so if you don't get in early, then it just gets deeper and deeper into the system, and it's harder
Right.
to resolve. And the same with long COVID. So even if they didn't have much of an infection, but they had quite severe long COVID symptoms that kick in maybe 3-4 weeks after the infection, the longer that's been going on, the more entrenched it is. Or also wrong treatment. So, for example,
Vitamin C, ginseng, things like that, tonics.
Yeah, exactly. So if people have been given tonics when the pathogen is still in their body, it's kind of locked it in rather than expelling it. And then so the next infection that I had herbs on a medicinal dose the week beforehand. I started my Shiatsu on the day that the infection kicked in. I had herbs within 48 hours of getting the infection, and on that Monday where the lung heat really built up, I was doing self shiatsu every hour, and my experience post infection is totally different. And so,
Right. So there we are. You see
the right treatment at the right time. Yeah.
Yeah, sure. Obviously, high viral loads are a risk factor. If you had just had more of it in you.
Yeah.
And then variant differences. That's affected, hasn't it, as the Delta variants come in, and that's been a risk factor. But I suppose from a TCM point of view, diet and poor nutrition, with a lot of damp in the body already, and a lot of people have got diabetes already, then obviously that's not helping, is it?
Yeah. So. And I think also with recovery after an infection, to have the right kind of nutrition. So if people go straight back on their diet that they were having before, if it was a poor diet, then I think their recovery will be longer. But I was so lucky that, we in our household, we were having chicken broth every day. And when I wasn't strong enough to make it, people I were living with were making it. We were all, giving each other exactly the right things to, restore our fluid physiology. And even like for a good 3 or 4 weeks afterwards, we were super careful with what we were eating. And then, our energy came back well.
That's brilliant, isn't it? Yeah, because there's also a danger that people will start going on to like raw juices or something like that, that are really heavy duty for the spleen, or damp producing foods and things like that. So again, that's something that we can really help people with in a very simple way, isn't it? During that time. Okay, of course, age is another major factor. Remember the statistics that came out at the beginning. It was mainly elderly people that were actually dying of COVID in the beginning. And environmental factors as well, air pollution, smoking, if you can call it that, and environmental issues. They're all factors that. And
I think also it seemed to be people who are living in overcrowded conditions and also in damp conditions as well. So where they were living, this wasn't healthy for them. The virus can spread much more quickly, and also if you're living in a damp environment, it weakens your immune system. So I think that could be a thing.
They're all factors, aren't they? Okay. So now that's the occurrence and the Western medicine. So now we're going to get onto the Chinese medicine and the Shiatsu, introduce you to the Shiatsu side of things. So we thought we'd just run a poll. How would you rate your understanding of Chinese medicine, just so that we know how much explanation to give you as we move through the webinar, and in fact, as we move through this 5-webinar course. So let me run that poll. I'm just going to share it now, and the options are expert, good, neutral, poor, or 0 for those of you. We don't believe you if you say 0, by the way, but because you probably know, even though you don't realize you know it, kind of thing. But look, someone's put 0. Oh. There we are. Okay, right. So we've only got, again, it's a third. A third of people are good or expert, and 2/3 are neutral, poor, or 0. So we've got quite a large proportion of the webinar participants who are saying that they don't have that much TCM. So what we've done is, maybe at this stage, it might be worth mentioning that there is actually a TCM and Shiatsu online course that's sitting right there on New Energy Work if you really want to find out about the basics of TCM. But what we've done in this webinar, Malika and I have put together sort of the essential of what you really need to understand in terms of treating COVID, okay? So let's just go through these bit by bit, because you hear a lot about this LPF, don't you, which is like lingering pathogenic factor, retained pathogen. What does that really mean, Malika?
So depending on how it presents, we treat what we see. And so if somebody has recurrent fevers, recurrent sore throats, if they have regular body aches, if they respond, for example, if when it's raining, they suddenly just start to feel fluey, or if it's not necessarily they always get a spike in temperature, but they have a thing where they just feel a bit fluey, and then if they break a bit of a sweat, then they suddenly feel fine. These are all signs that there could be of either a viral fragment is still stuck somewhere in the body, possibly in what's called the mo yuan, which is like the fascia of the body, or it could be that a whole virus is somewhere that's still slightly active but causing like a microsite of difficulty or inflammation. Or what it could be as well is almost like the body's memory of a reaction to a virus. So even if the virus isn't there causing the problem, it's almost like the body's like still stuck and it's still having these sort of reactions.
Right.
And so there's a specific treatment principle in herbal medicine, which is to bring out the retained pathogenic factor, and whichever one of those, and there's slightly different ways of treating it, but when it's stuck in the fascia, that's when I think having some kind of movement therapy and the herbs, because the movement almost like stretches it so it then presents itself, and the herbs give it a way out. And sometimes it can get stuck in the body because there's a bit too much deficiency. So then when you boost when you nourish, then you also need to release the exterior as well. So you use something sweet, but also something pungent, so that the body can kick it out, and then you give it a way out. And so I think when there is a retained pathogenic factor or lingering pathogen, then having both of those together really helps to get it out. It's also with anything that's chronic. Sometimes there's some kind of lingering pathogen there. Yeah.
And what we'll be doing in the next few weeks is we'll be looking at each of the burners, won't we? And we'll be looking at some of the some of the techniques that we can use and points that we can use to release the exterior, and we can do that thing.
Yeah.
I mean, I've had more than one experience of actually being able to feel heat in the channels, for example. Like sometimes you get the heat will actually get stuck in the channels.
Yeah.
And that's something you definitely, if you can feel it, you can work it. That's why.
Exactly.
It's kind of making putting what we do all the time and what what you will inevitably feel as a Shiatsu practitioner, putting that into a theoretical framework so that you can feel confident what you're doing and know when it's the right thing to do. I think that's the important thing, isn't it?
Yeah.
Okay, so also, and similar thing, isn't it? Stagnation, heat and toxins.
Yeah.
I guess stagnation is easy to understand in the sense that it's just things not moving.
Yeah. Yeah.
Heat, again, is heat created by inflammation, either internal or external heat. And again, it's something that the Shiatsu practitioners were quite capable of feeling. I'm sure everyone must have had that experience where they've actually felt parts of the body that actually do feel hot, either in the hara or on the channels. But what about toxins? What's the TCM deal on toxins? How do they differ from stagnation and heat?
Yeah, so there's two. If the retained pathogen is still active and it's stuck somewhere and it's causing localized inflammation, there was a study recently on erectile dysfunction, and when they studied the tissue, they saw that the virus was sitting there causing localized inflammation that was disrupting the erectile function of some of those cells. And so then there's they're called the fire toxin herbs in Chinese medicine. So they're the really strong antiviral, antibacterial, antifungal, antimicrobial herbs that will go in and neutralize them. And also when inflammation has come to a point, sometimes there's some inflammation, but when it gets infected, that's also turns into toxic heat. Toxic heat. And I think that is where herbs are your trump card, because they do have very, very strong, they are the very bitter herbs that can be challenging to take, but they work a treat, and they take the heat out and they neutralize the toxin. And so that's for things like when, say, for example, you have a chest infection that becomes from a viral chest infection to a bacterial chest infection. That's where the heat has become like toxic heat, and it gets quite dangerous, and it needs, you know, active treatment to it.
So that's definitely a job for the herbs.
Yeah.
Okay, then we've got retained heat. That's similar to retained pathogen. What's the difference between retained heat and retained pathogen?
I think it's basically when there isn't really any active pathogen there. But there's little pockets of inflammation that have kind of got stuck. And also it can be like yin deficiency heat. So when it's a bit like saying when the engine's kind of run out of oil. So if you send in a lot of cooling herbs, yin nourishing herbs, it can help to neutralize the heat. And with retained heat, and with retained pathogens, sometimes you see it on the tongue as they've got loads of tiny little red dots all over the tongue. So it's not in one specific area, as in the whole tip of the tongue, it's like little dots. Then you kind of know that there's some retained pathogen, there's some retained heat that needs clearing.
Right. Okay. And I'm sure that Shiatsu can help that if it's in the channels as well. Again, from what we were talking about before, and we'll definitely look into that in more detail when we do the following webinars based on the burners. Okay, so this is a very interesting thing, and this is definitely in the realm of herbal medicine, because I know the 6 divisions are a way of understanding how disease factors go deeper into the body.
Yeah.
So this is a really significant understanding, I think, about the triple heater and gallbladder level, the Xiao-Yang level, because it's all to do with what we were talking about before, which is understanding what the energetics are behind the relapses that you have as you go up and down, because it's very much an up and down thing, isn't it?
Yeah,
recovering.
Exactly.
So what exactly does that mean, the Xiao-Yang layer?
So when I came to see you and I was having herbs at the same time, that was a classic picture of a Xiao-Yang. So I was having recurrent fevers and recurrent sore throats. And it was like as soon as I started to get better, I didn't have enough energy anymore, because I was mashed after all those weeks of being ill. I just didn't have enough energy to kick it out. So my body would kind of like mount a response, but and I had this sensation also in my gallbladder channel of it being like jammed. So it feels a bit like a vice, being everything just like stuck in, and it's on a pivot. So is it going to go in deeper into the system, make me really, really sick, or is it going to get out and leave me alone, kind of thing? So when it's on that pivot, the key dynamic of the classical formula used for that is it has some nourishing in it and it has some dispersing in it as well. And so the 2 key ingredients are dates and ginger, and then either side of that there's some other nourishing ones and then some other exterior releasing ones. And what that does is it gives some central energy to kick things out, but also strongly releases things. So and that's a way of it's called Xiao Cha Hu Tang, and it's been used so many times with people who have these current relapses. So it's almost not so much the gentle, recurrent stuff, recurrent slight sore throat. It's when you're properly getting sick again. And so it's and it can be quite confusing as to know what to do with that, because you think you're so much better, you can feel so much better, and suddenly you're really sick again. But you're properly sick when it's stuck in the Xiao-Yang.
Okay, so that's interesting. It's worth knowing if you get clients who are in that state, then I suppose when you're treating with Shiatsu, it's that tricky balance, and I've had that so many times over the years treating like ME and post-viral syndrome. It's always tricky decision to make of how much to sedate and how much to tonify. Are you going to tonify them, or are you going to sedate? Or in other words, are you going to release stuff, you know, or are you going to build them up, sort of thing?
Yeah. Yeah.
So I guess when it's at that stage, you're kind of like halfway in there, where you've got to do both things.
Yeah. But I think also with, you know, with the horror diagnosis as well, which is why it's so important, because you can see where is that person at right now. Because if you catch them at one point, then they may have gathered enough to do some releasing, or if you catch them at another point, they're just so deficient. It's like they just don't have that to do that, and they're just too poorly to do that. So, you know, yeah, that's why I think that's the beauty of the horror diagnosis, because on that day, you know exactly where they're at.
Yeah, brilliant. Yeah, absolutely. Okay, so they're the 4 main things we thought you should know. And if you need any more information, then it's pretty good idea just to do a little bit of research on that. But hopefully that makes some sense. So hopefully now we can move on to the next stage, which is understanding COVID-19 progression. And I think this is, you know, with the research that I've done, this has been really useful to really understand how it develops, because apart from anything else, you can understand why these symptoms occur. And I really think that's one of the massive strengths of Shiatsu and TCM, is that it's actually pretty understandable for us, isn't it? Western medicine going, oh, we have no idea, you know, it's just like, you know, but it's actually pretty understandable in terms of Chinese medicine, the progression and also the treatment modalities. And that's, I think, a massive contribution that we can make to the whole long COVID thing. What do you think, Malika?
Absolutely. And I think hearing the testimony, I don't know if people have been in, you know, some of the support groups on Facebook, but hearing the testimony of people, many of whom have either used Western medicine all their lives and it's been wonderful for them, people who've been working in the industry, the Western medicine for so many people has shut the door on them, because, and it's not their fault, it's just they don't know what to do. And I think our principle of treating what we see, we don't need to get freaked out by, oh, this is a new virus, oh, we don't know what to do. It's like, well, it will treat each person according to that person's pattern. So we treat what we see, and we treat it until we don't see it anymore. And we know how to respond to it. We can't guarantee how long that will take for that to shift, but we know what to do.
Yes, exactly. Yeah. Okay, so here we are. We have the damp fire toxin invasion. That's essentially what that means, is actually the initial infection, doesn't it?
Yeah.
How the infection occurs.
Yeah.
And then what happens is we get retained damp, either with plus or minus, in other words, with or without kind of thing, any amount of heat that comes with it. And we put this note next to it, didn't we? That at that stage, you will feel obstruction and heat palpable in the channels. And that's a really important thing to know, because that's this kind of thing that we do all the time, every day of our lives as Shiatsu practitioners, something we're very familiar with.
Yeah.
So then we have that retained damp, with or without heat, then can be subdivided into 2 main effects. That's phlegm, which is basically a more congealed form of damp, which is more pathogenic. And that can affect the different burners, one or more of the different burners, giving different symptom patterns. So in the upper burner, we'd expect to get things like insomnia, cough, obviously lingering coughs, the middle burner, more digestive issues, and then lower burner, UTI, urinary tract infections, and bowel problems. Or when I say or, it's not going to be or really, is it, Malika? It's probably going to be both, let's face it.
Yeah.
We're going to have phlegm, but we're also going to have key and blood stagnation. And that's something that, again, that we're going to probably palpate when we're doing Shiatsu. And basically that means that the key is stagnated, first of all, and then the blood stagnated through the whole body. And that's what happens. The pathogen gets trapped inside, disrupts the triple heater. And then depending on all those risk factors, it will depend on how much that actually affects the individual person. So I don't know if there's anything you want to add to that stage, Malika.
Well, there's something about damp. I remember in my early studies, I thought damp was just when you saw edema. And then, you know, working with, studying about different things, and then also feeling it in the body. Damp is almost a bit like when the tissues have become dehydrated, which again, that's how you can get heat as well. And then, and also in the microbiome. So the digestive system is naturally a bit damp anyway, because it needs to be. But it's when say the microbiome becomes disrupted, or there's an excess of something in the microbiome, then
when you say the microbiome, you mean the flora, the gut flora, you mean?
The gut flora, starting from the mouth all the way down through the digestive tract. If there's something that is in excess or deficiency, then it's also a damp condition, which is why the spleen function being restored is so important. Because when there's dehydrated tissue, it is when the fluids aren't flowing, and then the sensation of fatigue, and the other things that we experience with damp, is restoring that really good and vital fluid physiology that's so important. So when the fascia are stuck, then with the obstruction, which you can feel, then there's going to be damp, because the fluids won't be able to flow properly.
Right,
so
exactly.
However much water you drink, if the fascia is stuck, then your flesh isn't going to get all nice and juicy again. So
absolutely, and I think we've all had that experience of that's exactly what happens when we do Shiatsu. When we do a thorough Shiatsu treatment, you just get that feeling of continuity in the body, and that feeling of the hydration in the whole body, which we're all familiar with, and that is so essential, isn't it, at this stage?
Yeah.
And also, of course, key stagnation. Again, Shiatsu has to be one of the treatments of choice to keep the whole body energy moving. I mean, I know obviously acupuncture can do it as well, but Shiatsu is, I think, probably the treatment of choice for that. I don't know what you think.
Malika. I think based on my how phenomenal each Shiatsu treatment was, it was like almost a bit like it's like this quantum healing moment of going from one person who was so stuck, and then suddenly with such a strong release in the fascia, and feeling all my fluids being able to flow better, and releasing the mood that I had been in before. I think it's something that's been talked about a lot, which is people struggling with anxiety and depression. But the switch around, going from such a stuck space and feeling that fluids, I feel sad sometimes that if people don't have access to that, because of how quickly I went from feeling completely horrendous to this, a real release, and it can happen very fast. And then, like all of the nourishing in the world, it can soften that, and it is very good at that. And there are chi regulating herbs in herbal medicine. But I think when something can so specifically get to the fascia and have these, real releases, in some of mine are like I'm jumping off the floor like I've had an electric shock, and something's just different. And I think I wish everybody could experience that.
Absolutely, yeah. Okay, so then after the next part of the story is, once we've got that phlegm, qi and blood stagnation, is this can then progress into, and this is what we see more in long COVID, isn't it? We see these different patterns coming up. We're either going to have yin deficiency, and if you're not sure of your TCM, what that means is the yin aspects, the cooling and lubricating aspects of the body become deficient. So you get what's called deficient heat. So you get like a flushing, a kind of empty heat feeling, restlessness, that kind of thing. And that can usually affects the kidney, liver and heart, because they all rely on kind of a cool, fluid, yin sort of thing happening. Or you can have qi deficiency or stagnation, and that tends to affect slightly different pattern, because obviously the qi deficiency and stagnation tends to affect it can affect the kidney and liver as well, and the heart, but also the spleen. The qi deficiency is basically when you're kind of basically tired, when there's just not enough energy and everything is kind of low, deficient. And then if you've got stagnation, that means that it's obstructed. And the key question to ask is it better for rest or movement? Because deficiency is usually better for rest, and stagnation is generally better for movement. The tricky thing though, Malika, when you get chronic conditions, is it tends to be a mixed pattern, doesn't it?
Exactly.
And so you get that classic thing where people feel a little bit better when they move, but if they do too much, then they feel too tired.
Yeah.
And the same with the Shiatsu treatments, isn't it? It's balancing that
Yeah.
moving aspect of the treatment with the tonifying.
Yeah. And I wonder if that links back also to that, the monocytes thing we were talking about earlier, is that if there's systemic inflammation, then, you know, too much moving actually then promotes the inflammatory response. So it's having that balance of enough movement so that the stagnation can move, and help the nourishing things that we're doing to reach to tonify the yin, but without doing that inflammatory response, and then you have the massive crash. So yes, it's enough movement and then enough nourishing, because also too much nourishing, if you haven't got the energy to process it, you haven't got that yang to move things, then there's only so much chicken soup you can have at a time, because it's like I can only do 3 spoonfuls, because suddenly I just don't actually have the key energy to digest it. So it's just sort of like slowly. I mean, there was a couple of days I was on baby food, because I couldn't face anything else. So I was just on this like stewed apple and 2 teaspoons, and that was me done. But that's all I could do at the time. So yeah, knowing how to balance it and how to pace it is key.
And it is also always an experiment, isn't it? You have to work with your clients, get feedback all the time, you know, and you will make mistakes. I've made some mistakes over the years with post-viral syndrome where I've done too much moving and it's wiped them out too much. And the same thing, too much tonification, it hasn't moved enough. It's very, but you've just got to get in there and do it, really, haven't you?
Exactly.
And work with them, because it's a journey you're going to go on. You're going to go on a journey with your clients.
Yeah.
But I think the thing is, if you've got the confidence to be able to understand what happens when people have reactions, you can move forwards with your clients, can't you? Rather than go, oh my goodness, you know, what have it done?
Exactly. Yeah.
Okay, so let's have a look at the other thing, and then finally we've got the retained pathogenic factor, which is the pathogen trapped in the fascia, which we've already talked quite a lot about already with the inflammation and everything. So that's what tends to happen, and that's what happens, and that's what we're presented with when people come in to be treated. Okay, so just have a quick look at some of the common symptoms that you're going to come up against, and what we've done is we've put them into the burners, as you can see, but we've also included a mind Shen section there. And probably no surprises here, really. I mean, if we go from the bottom of the chart, we've got the lower heater, obviously related to the kidney and bladder. Fatigue is a big issue, obviously. You want to make sure that you can get the Ming Men tonified. UTIs can be affected by damp, can't they, in the lower burner?
Damp
and
heat.
Gynecological issues as well. Both tend to be damp heat issues. In my experience, they work very well with Shiatsu treatment. Can be treated, really well, especially if you combine it with Qigong breathing and things like that. So we'll do that more in detail when we get to the lower burner webinar in a few weeks' time. And then we've got the middle heater. That's dominated by the digestive organs, the spleen, stomach, liver. We've got abdominal symptoms, obviously digestive symptoms, just saying about the gut flora and everything. But also we've got brain fog in the middle burner, haven't we? And that's because of damp, isn't it?
Yeah. So if there's too much damp in the system, again, damp can be like really deep dehydration. Is the heat that is from yin deficiency can almost like make the mist rise, so it sort of mists up and then blocks the orifices, the clear orifices of the mind. It's pretty it's pretty strong. It was like a month ago, I couldn't remember any of my passwords, and as I went into town yesterday, I suddenly thought I can do all my my passcodes for my bank cards, and it's quite phenomenal how much it affects everyday life, and it's quite astonishing how debilitating it is. It doesn't sound like a bad symptom, but it really is.
Okay, it can really fog your brain. I mean, I found that with a lot of clients. And then the upper heater, obviously we've got breathing, get heat in the lung channel, chest and throat pain, cough, and palpitations as well with the heart. And then look, anxiety, depression, post-traumatic stress disorder, that was the most common of those 37% of people. And we've got obviously not just the heart, which is the Shen, but we've also got the Jing Shen link, haven't we? The kidney and the heart, which we'll deal with. We've got a lot of questions, so I'm going to just see how we're doing here and see if we can at least get through some of the questions. So here's a few things that Shiatsu is best at. Malika and I put these together. Just want to emphasize that we do have the tools to help multi-system pathologies. And because we work holistically and because we work the body as a system, we're really well placed to do that. And we're going to look at a lot more detail at all of these things in the next 4 weeks. But basically, clearing heat by moving key, we talked about that before. Mobilizing the key in the channels is basically stimulating the fascia, which is basically nourishes the yin in the body indirectly, and that's anti-inflammatory. We all know about switching on the parasympathetic nervous system, so important with anxiety and depression. Sleep, insomnia is another big one. And again, we're well placed for that. We've got lots of techniques. The hun and the shen need to be settled basically in the body. And then we've got mental and emotional issues. And I just want to flag up the fact that we have got an online course on treating stress and trauma. If you want to go straight, more directly into that, you want more information on that, because Shiatsu is very, very sophisticated at working with mental and emotional issues, and I'm sure you know. And also we've got, this is something that I've found a lot of success with, which is tonifying the digestion, and that's basically working the spleen and stomach meridians, large intestine sometimes, to transform damp and damp phlegm. So there's plenty of things we can do, and if you think back to that chart that we showed you at the beginning with the different types of symptoms that people have, you can see that what we can do maps really pretty closely with that, with what's there. But the other thing we'd like to, obviously, because we've got Malika here, she's helping us so much, and with her own experience, obviously working with a herbalist can really, really help. So maybe you could just say what you think herbalism is especially useful for, Malika.
Yeah. So with resolving damp, Shiatsu is wonderful at resolving damp with boosting spleen qi and also restoring good lung qi with the the dispersal of the water passageways. And so in herbalism, we have 9 different ways of transforming damp. So while Shiatsu is wonderful, there's it can be so supported by having herbs. 3 main ways that herbs help to resolve damp is through promoting urination. So that's when there's just too much fluid stuck in one area, so almost then creating a block. So by promoting urination, we also can leach out damp from, and that's like taking, if there's an excess in the microbiome, and also aromatically transforming damp, which helps so much with brain fog. And so there's other ways of working with resolving damp. Those are three ways that herbs do, and you can see quite a quick there's quite a quick response. So if the damp is really, really entrenched, herbs are absolutely wonderful at coming in and really helping to resolve that quickly, helping the Shiatsu to do its work even better. There is, with clearing heat from the blood, that can become quite a tricky situation. And so it's when, when things are becoming, the inflammation is turning to infection. Sometimes using body work can be quite difficult, slightly contraindicated if there's an infection in a particular area. So if you then move that damp heat that's turned to toxic heat, it can sometimes spread it slightly. So if you have herbs in there as well, to help remove the heat and to resolve the toxins in the system, that can be really, really useful. Again, with edema, sometimes with edema and blood stagnation, using too much finger pressure with Shiatsu is contraindicated with that. And so with clearing edema, again, those herbs are really good at that. And also taking the blood from like sticky blood to more restoring the fluid physiology of the actual blood. So there's something that's moving towards a blood clotting situation that isn't great with strong palpation. Restoring good blood fluid physiology is really, really handy. And then clearing the retained pathogenic factors. Herbs are really good for not only bringing it out, but kind of knocking it on the head. And also with things like bacteria that's stuck in the system, they have this biofilm, and so herbs act as a biofilm interrupter. So when they're also like snuggled into the tissues, it helps to interrupt their protective mechanism and then neutralize them as well. So yeah, herbs are great.
Yeah, exactly, and a great combination with Shiatsu. So there we go. Okay, so we've got questions. If you've got any suggestions for the next few webinars, you can always email us at admin@newenergywork.com, and we'll be very interested to hear from you. We've got 5 minutes left. We've got lots of questions, but maybe I can just select a few out, and we can just see how we get on. We've just got a couple of more slides left, so let's have a look. We've answered that. Okay. This is some experiences that Andrea's just giving, an experience of different things she had. You'd be interested in seeing some of the things she took. It's quite a long. Yeah, here we go. Look.
Okay.
She was on high nutrients like vitamin D and a liver detox using a blend of licorice root, artichoke, dandelion, milk thistle, plus no sugar. The week I had it without realizing, I had high energy the day after a day of sore throat, gargled tea tree oil. On the one day I had symptoms, I sniffed peppermint oil, German chamomile, sweet birch, wintergreen for a headache, joint aches, could hardly walk up the stairs, and temperature, went to bed, and then woke up symptom free. So obviously she just got a really good cocktail of different things there.
Yeah, just like bust it out and then have a good rest and wake up. Yeah, these I think these sound, well, licorice root we use quite a lot in Chinese medicine. They sounds like they come from the Western medicine tradition.
Right.
We do use peppermint, but not in an oil, in a herb. And so, yes, but yeah, no, they sound lovely. I love Western medicine.
It'll all depend, of course, on the strength of the onset and the viral load as well, about how effective you can use something like that to. Catherine asks, she came in a bit later. Is there any info on what helps get a lingering bit of a virus out of the system? We talked a little bit about that, didn't we? About how you can do that. I don't know if you've got anything else to add to that.
Yeah, it's having if it's stuck on that pivot, it's having something slightly tonifying, but also giving it a way out, which release the exterior. But I think we're going to talk in later webinars specifically about how Shiatsu can help release the exterior.
We are, yeah, exactly. Yeah. So make sure you tune in next week, Catherine. We're going to do the upper heater, so we'll be talking a lot about the lungs and everything like that. Here's a, I don't think we can't really, we've got so many questions. I'm just going to pick out a few and then we'll have to finish up. Let's see. Here's one from Feline asking, what about neurological issues? Let's just see if I can get that up. Yeah, what about neurological issues? Where do they belong in TCM?
So, it would, I think with neurological issues, you would need to have a full consultation to see exactly what the underlying patterns are, how long it's been going on for, and how it's presenting. Because sometimes neurological issues, for example, can be liver wind if there's phlegm obstruction, and so it might look like a neurological issue, but that can be cleared by helping to settle the liver and clear the wind and the phlegm. And sometimes it's low-grade inflammation in a specific area that's interrupting, so that would be retained heat. I think it's it can be so specific. It would need to have
it needs an individual thing, doesn't it? Just one last thing from James. He's very interested in herbal remedies. Are there any books that you could recommend for introducing herbs? Introducing
herbs books. Okay, that is something I'll need a little bit, but there's so many books that come to mind.
Okay, well maybe we can answer you next, James. We'll answer you next week. We'll do that. And in fact, we could put that in the last webinar, couldn't we? Some suggestions, further reading, or we'll put it on the online course.
That's a good one.
Okay, I'm sorry if anyone's asked a question that I couldn't get to because we've got to finish up now. I'm just going to finish up with the last few slides. Okay, so next week we'll be looking at treating the upper burner, and we'll be looking at obviously the early stages as well, because that's where the pathogen enters the body through the lungs and to the digestive tract. And we'll be looking at some specific techniques. We'll go deeper into how the TCM links with Shiatsu and practical experiences that Malika had with her own COVID journey. And that's it. I think we've got to finish up. Thank you. I'd just like to say thank you very much, Malika, for
Thank
sharing
you.
all your expertise and your experiences. It's been a great pleasure to work with you. Really enjoyed it. And I'm looking forward to spending the next week working on the next webinar.
Yeah, I so am.
And thanks ever so much to everyone. Sorry if I couldn't get around to one of your questions. Please come again next time, and we'll have a question and answer session at the end of each webinar. Such an important topic. Shiatsu's got such a lot to offer. We really would like to give you as much confidence as possible to help your clients and be able to spread the Shiatsu and Chinese medicine knowledge out there. Okay, so thank you very much for your time in attending this webinar, and we'll see you at the same time next week for the upper burner. Okay, bye-bye. I'm just going to look on the chat and put a heart in the chat just for everyone. Yep, there we go. Everyone's got lots of clapping hands there, Malika.
Oh, I'm so grateful. I'm so happy that I've been here. Thank you.
There we go. Cool. Okay, see you next week.
Bye-bye.